Hi everybody, today we're here in lovely Del Mar, California, and we're going into M Beauty by Dr. Tess, Dr. Tess Mauricio, America's favorite dermatologist. And today she's going to be doing a procedure called the time machine on me, and this should be really good. It's quite a procedure, and we're going to meet Dr. Tess right now, and she's going to walk us through it, so let's go. Hey, Dr. Tess.
Hey, Patrick.
I get hugs because I'm a special client.
Yeah, I know.
The big news is you have your own TV show now.
I know, the Dr. Tess show, and watch out for it. And I'm really excited because we're actually going to be covering all of the latest treatments that will keep you looking young. And you know, Patrick, we've done a lot of work together before. Oh, yeah. But today, Patrick is going to step in Dr. Tess's time machine. That is the latest, and basically it is putting together all of the latest technologies to address all of the issues that happen with aging. Yeah. And I'll show you some really amazing before and afters, and then you'll obviously get to watch Patrick's transformation. He doesn't need a lot, but it's more for Patrick, like maintenance and keeping him looking great.
There's two things. There's regeneration and there's repair and there's maintenance. So basically we're going to be addressing, you know, some of the issues that I do have, and we're going to be doing preventative work.
Right, and you know, nowadays with the great technology that we have, you really never have to look old. You never have to allow yourself to deteriorate. You can always look great, looking your best at any age without surgery, and that's what we're going to do with the time machine.
Well, let's get started.
Let's go. This is our new Del Mar office, by the way. This is really wonderful for patients who want overall rejuvenation. This is why we call it the time machine. Sure. The time machine, because we're stepping into it, we are using combination of treatments, and we're addressing all of the things that happens with aging. Yeah. And for example, a patient like this.
And then she's like a typical, what, about a 40-year-old?
Yes, mid-40s, and she's starting to have issues around her eyes. The eyelids are drooping, eye bags, nasolabial fold,
which is this
getting
here.
Very deep. She's losing volume in her cheeks. She's sagging, and we put her in the time machine program. And this is a couple of sessions which we're going to do to you. And this is her a month after.
Yeah, this is actually unbelievable results, in my opinion.
Technology is available, and when you combine technology with expertise and utilizing all that we have, it's fantastic what we're getting. It's life-changing, and so I really invite anyone who has issues to come in and get help, because you will enjoy your life to the fullest when you have great skin.
Pretty lucky nose, ladies. So well, let's get started.
Let's get going. Let's get Lisa.
Well, it's time to get serious, Dr. Tess. You actually have your coat on.
That's right.
This means it's time to do some special things here, right?
It's time to walk into the time machine, and we start with the numbing cream. Lisa's gonna apply it. Right. And this will stay on for about 45 minutes because we want to make sure you're, you know, good and numb, and we're gonna put it around your eyes, everywhere. And so this is the step one, and then after this, then we're gonna do some.
You know that
I know you always are special.
I always say I feel like a glazed donut or an ice cream.
Yeah, this is it. We'll have a very special guest just to draw your blood.
Not the Korean contract killer.
He's really nice.
He's gonna kill me Gangnam style, man. All right, well, you know, we're gonna let this sit for about 45 minutes now, and when we come back, we're gonna start with what?
We're gonna start with the fillers. We're gonna put some Restylane in, and then we'll do the laser, and then we'll draw blood, and then that's it.
Exciting, right on.
Okay.
We'll be right back.
Yep.
My face is getting numb. I put a little on my lips and a little on my eye, but it feels kind of like my lips feel real numb. And then we have Dr. James Lee here. He's a summa cum laude graduate, right, as well? Is that correct?
Cum laude, yeah.
Cum laude, okay. So he's gonna go ahead and draw my blood down. And what are we doing here, Tess?
We're gonna create today with the laser are basically little tiny microscopic wounds.
Okay.
And so instead of waiting for Patrick's blood to actually supply the platelet-rich plasma to heal and also create collagen, we're gonna be kind of cheating in a way where we're gonna concentrate the PRP, or platelet-rich plasma, on the areas that we have resurfaced, and that one will make him heal faster, so your recovery from your laser will be quicker. And second, it's like fertilizer in that it actually will boost the collagen that's going to be produced in filling, improving your wrinkles, improving the under eye area. It's just fantastic.
Good job, Dr. James Lee.
And one stick, that's why
30 seconds.
this guy is also very, very good with the needle.
He is.
And other things.
And because I'm not the easiest guy to rub.
I know you were saying,
I have
right?
really thick skin, right? You noticed that, right?
It was incredibly thick, like an elephant.
Yeah.
All right, so we're putting in this tube, and this is what we're gonna spin down in a couple seconds.
Okay, all right.
So it goes there.
Yeah, I like that little James Bond look you got going on right there. You're like,
Yeah, there you go.
it's elementary, my friend. There you go.
All right, I'll be right back.
All right.
We have Patrick's bun right here. We're going to prepare it right now by inserting it here into the centrifuge. We'll spin it down for 10 to 20 minutes. And here we go.
Well, I'm not all the way numb, but it doesn't really matter with this because this has built-in lidocaine, right?
Right. So this is a filler, Restylane hyaluronic acid filler. And basically what we're gonna do is we will fill this very, very faint line there and then across your nasal bridge and then also a tiny bit here. The hyaluronic acid fillers actually act synergistically because it's acting as a scaffold. So now there's the gel that's there and your own collagen will be produced around those gel to give you even extra plumping and refilling. And for people who really have lost a lot of volume, some older patients, or people who don't have as much dense skin like you, it really makes a difference to do the filler before we do the laser resurfacing and then the PRP. So take a look and just focus right on the wrinkle here, because the great thing about these fillers is that you get instant result. If you really want to instantly get rid of lines that are just there and just won't go away.
Sure.
And then I'm gonna fill this.
Good. Yeah, those I've noticed those lately.
And these fillers now already have lidocaine, which is a numbing medicine, in them, so that by the time I finish, the area actually will feel really numb. Okay, and this is the last side. See, wrinkle gone.
Loving it.
We're gonna fire up our CO2 laser, and this is the Mixto Pro. It is the latest in technology, and it delivers amazing results. And the cool thing about this machine is that I can really customize the aggressiveness of treatment depending on the skin type and also the downtime that the patients want to have. So, for you said you just want me to just go for it, right?
Whatever, yeah.
We're getting you ready for a lot of shoots coming up, so let's just go for it. Turn your face away from me.
Okay.
And then to see this going. Turn on. So there's the laser beam. And what we're gonna do is what's called fractional resurfacing. So about 20% of the skin surface is actually going to be vaporized right on the spot. Okay, here we go. So you can see that it's laying down this pattern, literally vaporizing old skin. And this whole process is going to start new collagen production under the skin. It's going to start a healing process that includes laying down new collagen.
Okay.
So this will treat the sun damage, the discoloration, the red, the brown, the texture changes that happens with sun exposure and aging. It helps with wrinkles in the neck. It also helps tighten the area. So it's fantastic.
Well, you definitely want the numbing cream, guys. Because right here where it's not, you're like, oh boy.
Big difference,
Yeah,
huh?
oh yeah, big difference.
But then it's Patrick, so I always do something surprising for Patrick.
She lets me know she's the boss,
exactly.
She goes, you mess with me, kid, I don't like your jokes.
Exactly.
You're gonna get the laser.
I'm one of the few people who can make Patrick be quiet.
Yeah, pretty much.
So we finished your neck.
Great.
That's the mixture resurfacing
That's
on
so
the neck.
live.
Yeah.
Little fried chicken in the air,
exactly. So what we'll do is we'll take off the numbing cream on Patrick's face, and then we'll work on his face, and then we'll finish it off with the PRP.
Okay.
Okay?
Nice look on Lisa, by the way, with those glasses.
Right, exactly.
Looks like you're ready to play a racquetball game. They're polarized. No, I'm just kidding.
So PRP is the last and final step for today, the session of our time machine. So we drew your blood, and all of this is Patrick's red blood cells that's compacted here. And you see this clear yellow fluid that's floating up on top. That is the platelet-rich plasma, or PRP.
Okay.
And you know, they already drew it up for us. And what we're gonna do is, you can relax. We actually apply it right on the surface of your skin.
Okay, let's see. It tastes a little
How does it
salty, but kind of sweet.
That's because
sugary.
he won't stop talking. Just kidding. So one of the cool things is you'll observe that, you know, immediately after Patrick was kind of really swollen, and you can already see that just applying the PRP, his skin looks more normal now. Look, it's good. The swelling's gone down.
Right.
He's not as kind of traumatized looking.
Sure.
And what I do now, next final step, is to actually inject it. So we're gonna inject it in the under eye area. Ready? Not as bad as it looks.
No, it's not bad at all.
This is really tiny.
The laser was
Tiny.
a lot more than this.
Yeah.
Yeah.
If you're thinking about surgery, this
Right, that's
is
correct.
nothing, exactly. There is really, you know, the downtime, the recovery, and you never have to think and worry that you're gonna look unnatural. Patrick,
Wow,
first,
Tess, that
what
felt
do you
pretty-
think?
You know, since you put the my own platelets on there, and what do you call it, PRP?
PRP.
That it really calmed everything down. Amazing.
It's really amazing, and it happens to every single patient because we are harnessing our own body's ability to heal. These are the same cytokines and growth factors in the platelet-rich plasma, or PRP, that really helps us heal, but we have now concentrated that in the skin. We're also going to add some more products on Patrick to really help decrease inflammation and help you heal faster. One is vitamin K, because obviously I did a lot of injections and we want to minimize bruising, and vitamin K cream will help with that. And then also we're going to apply a product called Tensage, which is a phenomenal growth factor from little special snails that has been used to treat radiation treatment burns for cancer patients. So basically almost, you know, treat and decrease the swelling, cut down the healing
Yeah, I always
time.
call that, hey Tess, I need some of that snail juice.
Exactly.
Yeah.
These are special snail
Yeah,
juice.
exactly.
So we're really harnessing everything from
Nature,
your own
yeah.
body, from the latest technology, from nature, putting it together with, you know, expertise. And we are turning back the clock, literally. And Patrick's just been in our time machine, so you'll get to see how he looks when he comes back on our part 2.
Yeah, part 2 will be back, so stay tuned, and we're going to see Dr. Tess work more magic on me. Well, I'm back with the magic woman, Dr. Tess Mauricio. How you doing?
Great.
And I'm healing up. It's been about 10 days since our last meeting. What do you think?
I think you look awesome.
Yeah.
I just can't get over it. Your skin is glowing, and you know, you still are healing. So this is just the beginning phase of how this is going to turn out. Over the next few weeks, you're only going to get better. The
Okay.
redness is going to dissipate.
Yeah.
And the next step in the time machine process is trying to really give you an even bigger boost in the collagen making,
Okay.
you know,
Sure.
production here.
Good. That's right.
So we'll get started with the phase 2 of time machine.
Okay.
All right, let's
Thanks.
go.
Great.
All right.
Love it. All right, Tess, you got me on the table again. What are we going to be doing here?
Well, we're gonna do the Venus freeze, and again, this is the part 2,
Right.
session 2 for time machine, and that will give us a big boost in collagen production. And it's painless and no downtime this time, not like
Yeah.
our last session.
Yeah.
And to do this procedure is Lisa.
Hi there.
And Lisa's done some work on you
Oh, yeah.
before.
She's my favorite.
Exactly.
I love her. She's the
Yeah,
best.
and she knows how to do this. And
Yeah.
Venus freeze is great to use not just on the face, it's also used for the body, any area that we want to tighten, to plump, to tone. You know, it really is wonderful. And the beauty of it is that it's painless. So at 10 days post the first session of time machine, it's a perfect time to add this.
Great. Well, I'm
Okay,
excited.
all right,
Let's do it.
let's get
And we'll see you in a little bit.
Yeah.
All right.
Enjoy.
Thank you. Well, I'm back from the Venus freeze.
And did
felt
she
good.
treat you well?
Oh, are you kidding? You're amazing.
Oh, Lisa's great.
Awesome, yeah.
Yeah, okay, so now the last step is, now that we've erased all of his lines, right?
Pretty much.
Part of what happens as we age and why we have lines on the forehead, between the brows and around the eyes is the muscles of facial expression become stronger and they create creases in the skin that if we don't treat ahead of time, they actually can become permanent. So now that we've kind of given your skin a brand new start, we will maintain it looking like this by kind of treating the muscles a little bit.
So
not so much to freeze you and not
prevent.
give you, not to give you no expression, but really just to prevent the muscles from contracting too hard and creasing the skin, because we want you looking like you're in your 20s. So give me a big frown. So I just go right in, and this is not really treating the skin itself. It's treating the muscles that are drawing these in the skin and creating the creasing. Raise your eyebrows up. So we're gonna treat. So there's these muscles here called the frontalis that contract and creating these creases.
Sorry.
All right. So we're just gonna go in. And how does that feel, Patrick?
A little pinch.
Yeah, I tell especially women. I tell them this is less than the discomfort of plucking your eyebrow.
Yeah.
So this is the final one. And ta-da! All
Piece of
done.
cake.
And that's it. That's our last thing for our time machine.
That's
and
it.
then we're gonna come in and
You
do a
can't
little
wait.
cleanup.
She is so, you guys, she's so excited.
Yeah, you'll just be too good looking
Hey.
with a brain.
Somebody's got to do it, right? Besides you guys, right? All right, and I'll be in the crew.
Yeah.
I'll be in the group with you guys.
You belong now.
All right, well, I feel better. All right.
All right. Thanks,
well, thanks so
Pat.
much, and we'll see you soon, and we'll look at the results. Well, Tess, we're back. It's been 2.5 months now since we did the procedure, and
I can't get over it.
you're better.
You look so young.
I know. I feel better. I
Oh
feel
my
younger.
gosh.
I've been getting so many compliments. I mean, big time.
Because, like I said, I mean, I can't even get over it.
Yeah, I'm pretty happy. I mean, I didn't know it was going to be this good. And look at the forehead and this. And if you feel my skin, it's so soft. Isn't that ridiculous?
Oh my God, yeah.
Yeah, and now I notice a couple little things. Now that my skin is so smooth,
That's what
now I
happens.
said, hey, look, I got a few blood vessels and all.
Right.
So
And that can be treated, not a big problem. And when I talk to you, what's going to be the next
that's
steps
going to be awesome.
for those?
It's called
Photofacial, yes.
Great.
It's easy, no scabbing, no downtime.
Love
Just
it.
come in, flash of light, and then we take care of those.
And then another thing out of this, since I am looking so good, everybody, is I noticed on my right here from the sun when I was a kid being in the sun,
Yes.
I have like some freckles and stuff like that. And you said we can do the
sun
same process
Yes,
here.
Absolutely.
On the body.
As long as you have skin, it can be done. And
Wow.
I tell patients it's like remodeling your home. You fix your kitchen and now your living room doesn't match, and Patrick's face is looking like he's in his early 20s.
Yep.
And so now you're like checking out. And I just had my time machine treatment too.
Okay.
It's a little different than what you had because you have fair skin.
Right.
For darker skin like mine, I basically have to go less aggressive.
Okay.
But it's been almost 2 weeks, and every day I see an improvement.
It's amazing.
Yeah, the under eye, the glow, the color, and I did my neck.
I noticed your pore size is smaller.
And I did my neck too, and because over the years I've done treatments on my face and I've forgotten my neck, like what
Right.
you're talking
Oh,
about.
yeah.
So I'm trying to catch up my neck. So
Ooh.
I love it.
Awesome.
I love it.
So no matter what your skin type, you've got a solution.
That's what it is. Is like no matter what your skin type, no matter how your schedule. If you can't do the big downtime like with you, we had to do it a little bit less downtime. It can be done, and there's no cutting, there's no surgery. It's totally tolerable, and the results are there.
Well, and you still look like yourself, because see, I still look the
Yes.
same, just a younger, better version.
Exactly.
Thanks to Dr. Tess.
Thank you.
Thanks so much, Tess. I
Great,
get a hug,
Patrick.
right?
Yeah,
Oh
yeah,
yeah,
yeah.
the best hugs. Big hugs we've got.
Awesome. And then on to next better things.
Oh yeah, I can't wait. And thank you so much for being here. And until next time, just remember to
Enjoy.